You are listening to The Federal. This is Shubha Kirtana. On today's podcast, we're going to talk about the lack of easy access to emergency contraceptive pills and safe abortion clinics, especially for young unmarried women. With Women's Day just around the corner, I thought we should discuss an important issue which needs to be addressed. Today, we have with us Dr. Umar Ram, senior gynecologist with over 16 years of experience. Thank you so much for your time, doctor.
Thank you, Shubha. My pleasure, and looking forward to sharing this conversation, especially with Women's Day around the corner.
Right. The Drugs Control General of India, they made emergency contraceptive pills available over the counter nationwide. I think this has been around since 2010, if I'm not wrong. But why is there an issue with accessing them?
Yeah, so the emergency contraceptive pill, as you said, has been made accessible and available across the counter. And but in some states there was an issue with access, and Tamil
Mhm.
Nadu was one of those states for a period of time. But in the more recent times, there hasn't been an issue, and the drugs are available with pharmacies.
Mhm.
And the emergency contraceptive pill, popularly called the I pill, has always been available in the government sector.
I see.
So in
Right.
the PHCs and in the government hospitals,
Mhm.
it has always been available. But more recently, it is more easily available in the pharmacies. Though I must agree,
Right.
there was an issue with availability a few years ago.
But in the recent past, I mean, I've been quite active on Twitter, and there are
Hmm.
constant, queries or tweets that read, saying, we have issues accessing these pills, and that makes me wonder. I mean, is it going to be different for the government hospitals or privately run? I mean, how does it work?
No, I think the issue is that it is possible that all pharmacies are not stocking them, and or are not very ready to dispense them without a prescription as they should be. I mean, the whole point of an over-the-counter drug is that you should be able to walk in and pick it up without the need for a prescription.
Right.
So why it is not so easily available? I'm not entirely sure. There is no longer any taboo about placing these drugs in the pharmacies.
But I'm not sure. But I think at around December, I think in a news minute, they did a series of investigation reports
Hmm. Hmm.
saying that there is a problem with accessing these eye pills. But why do pharmacies not stock these pills? Why would they say we don't stock them? I mean,
Yeah, no, I am not entirely sure what the reasons are,
uh-huh.
but what I was trying to say is some time ago there was a prob, they were not, they were advised not to stock it, and that it should not be available across the counter. That scenario has changed.
Right.
So now it should be available, but I agree with you that it is not as freely accessible as it should be.
Right. In this,
So
huh.
it could be a reluctance in terms of, it may be that it is not that, pharmacies sometimes stock medications based on the movement, how much the drugs move. So there may be some issue with that. There may be reluctance to dispense it because they know what it is for.
Mhm.
But that is a personal, maybe a personal point of view. It is
Mhm.
not policy, is what I was
Right,
trying to say.
right. I get what you're saying. Um, so these things don't require a prescription, right? You can always walk to a pharmacy and you can ask for pills.
Ask for the eye pill, yes.
Eye pills, yes.
So the emergency pill can be, but the only caveat that I would add is that the woman should be aware of the appropriate use of the eye pill.
Right.
Okay, that's the next aspect. One is, of course,
Could
it
you
has
please
to be
throw more
accessible.
light on that, doctor?
So ideally, the eye pill needs to be taken within 72 hours of an unprotected intercourse or
Mm-hmm.
a sexual act. Within 72 hours. That is the window. If you go for the ask for an eye pill after that window, then
Mm-hmm.
it is unlikely to work. And more importantly, it works. So you cannot use it multiple times in the same cycle.
Mm-hmm.
So it covers only that act of intercourse. So if there is unprotected sex, let's say today, and tomorrow or day after the woman takes the eye pill,
Mm-hmm.
and there is another act of unprotected intercourse, say a week or 10 days later,
Right.
the eye pill taken will not cover that, and another eye pill taken at that time may not necessarily act as effectively as well.
Right.
So
Right.
these are facts that should be kept in mind uh,
Mm-hmm.
when asking or seeking the pill.
Right. I would like to ask you about the pharmacies that have a lot of misconceptions about the legality of these pills.
Mm.
I mean, so earlier, was there a ban on eye pills?
So I think around the time that uh, the eye pill was made freely accessible
Mm-hmm.
for a period of time, I'm not quite sure how many years,
Mm-hmm.
but for a period of time, the government of Tamil Nadu had not made it accessible without prescription.
Right.
So, but that was a phase, and even as doctors, we couldn't access, eye pill for patients if they
Right.
wanted it, and we had to use alternate methods of emergency contraception, which are available. I mean, the eye pill is not the only method of emergency contraception. But now that is not true, and in fact, most hospital-based pharmacies will have the eye pill.
Mm-hmm.
And as I said, most government sector
Right.
PHCs and public hospitals will have the eye pill.
Hmm. But there seems to be a misunderstanding among pharmacists on emergency contraceptive pills and abortion pills. Are they
Yeah.
same or are they different?
They're definitely not the same. An emergency contraceptive pill is precisely what it is. It is a form of contraception to prevent the pregnancy from happening.
Hmm.
If contraception of any sort fails, including emergency contraception, and a pregnancy happens, then you can have medical termination of pregnancy by using pills.
Right.
Those are the abortion pills, as they are called, and those cannot be, administered without a prescription, and will need a doctor to, uh, ensure that it's being taken at the right time,
Right.
in the
So,
right manner.
absolutely. So, globally, more than 16 crore women and adolescents who wanted to avoid pregnancy weren't using contraceptives. This was per 2019 report,
Mm,
a data.
mm.
So, contraceptives essentially it prevents pregnancy, and the most popular forms are condoms, birth control pills, and etc. But why do contraceptives fail in general?
I'll answer your question and then address the statement that you made first.
Sure.
Contraceptive failure is known to happen. Now, even if you have a permanent method of contraception, such as tying the tubes,
Mhm.
or for the woman or the man, there can be a failure.
Mhm.
So, even with most optimal use, sometimes you can have like a most optimal use of a birth control pill without missing a day.
Mhm.
Though the probability comes down, a freak ovulation can still happen. Condoms can tear. the
Right.
IUD can move. So these are the reasons why contraceptive failure happens. But more importantly, failure happens when there is a not optimal use. A woman may forget to take a pill on one day and then remember the next day and take it. Sometimes there could be some illness because of which one or two pills are missed.
Mm-hmm.
So those are or sometimes there can be some ejaculation before the condom is used. So these are reasons why you get contraceptive failure.
Right.
You may miscalculate the date. You
Mm-hmm.
may think you're in the safe period when you're not. So these are the commonest reasons for contraceptive failure. But
Right.
I agree with you that overall, world over, and
Mm.
definitely so in India, per se, contraceptive use is very low.
Right.
And that is regular contraceptive use. And so relying, so why? Because there are a lot of myths about regular contraception. There are concerns that it's hormonal. There are concerns that it may prevent pregnancy in the future.
Hmm.
There are concerns that the pill may cause weight gain.
Right. And
And with,
acne prone, things like
yeah,
this. Right.
Yeah, true. But actually, a lot of the facts are the contrary to the myths.
I thought we will eventually talk about that. I'm sorry to interrupt you here.
Yeah, yeah, no
So,
problem.
yeah. So, what should one do if birth control fails?
So if birth control fails, I think the first thing is to be cognizant of the fact that birth control may fail. And if you miss a period, check whether this could be a pregnancy.
Mm-hmm.
And if you're sure that this is a pregnancy that you do not want to continue, then seek medical advice as soon as possible. Because if the pregnancy is under 7 weeks, then it is possible to have a termination with medication.
Right. Right.
If it goes beyond 7 weeks, then you will necessarily need a surgical procedure most often. Though pills may work, the chance of failure is higher.
Right. So we were discussing myths about contraceptive pills that
Mm,
you must not believe. So
mm.
yes, I mean top misconceptions. So what they are?
Top misconceptions, I think one, that they will affect fertility going forward,
Mm-hmm.
which is not true. They work only as long as you take them, and they don't prevent pregnancies for years afterwards. I
Mm-hmm.
think the second most common misconception is pills will cause weight gain, and a lot of young women are unhappy or scared to take it for that reason. The newer pills are very low on hormonal content, and yes, there may be mild water retention, 1 kilo or so kind of weight fluctuation, but
Mm-hmm.
not 5 and 6 kilos on the pill.
I'm
That
sure. And what
doesn't
about
happen.
these mood swings and
Yeah. So mood swings can be a problem. So if women already have issues with uh, mental health or mental health concerns with depression, um, then sometimes the pills can make it worse,
Hmm.
but not for everyone. In fact, for sometimes for premenstrual stress and those kind of pre period mood changes,
Mm-hmm.
we use the pill to counter them as well.
Right, right. I would also like to ask you about the access to legal and safe abortion, which I think is an integral dimension of sexual equality. And more so, I think it's a public health issue. So, how do we achieve this?
So I think India has one of the most liberal uh, termination laws, and very early on,
Mm-hmm.
and it is access to legal and safe abortion is a woman's right anywhere. Um, till recently it was still 20 weeks. Now it has been extended to 24 weeks.
Right.
However, the longer you go, there are more issues with the process of termination. And so there can be reluctance from the doctor's side to terminate after 20 weeks or 22 weeks, even with the legality saying up to 24 is acceptable. But early pregnancy terminations really should be provided to everybody. However, I know that some doctors may not feel comfortable
Mm-hmm.
performing termination of pregnancy.
Mm-hmm.
It's just that they may, for whatever reason, religious, moral, not feel that they are comfortable doing it, and then usually they would refer to a colleague who they know will be able to provide the safe abortion service to the woman who is requesting it. The trouble is that when single unmarried women uh, go and request termination, sometimes
Mm-hmm.
they are met with, uh, you know, they are left feeling that they are judged, which I think is completely wrong, and that is not how one should, that's not what should be.
Right.
Um, but that is also, I think, changing as the younger generation of doctors uh, are more open and more accepting of providing it as a
Non-judgmental. Yes,
service.
yes,
Yeah.
100%. My last question to you, doctor. I mean, you said a lot of valid points. How it's more important, to be non-judgmental.
Hmm.
Uh, but the fear of, I mean, the trust and the initial hiccups of opening up to a
Hmm.
doctor has always been a tricky thing for single women, right? So
Yes.
how do we know that we are in safe hands? I mean,
No, I think you have to you have to obviously do due diligence before you go in. And I think most people would be open to having the conversation. But when you begin a conversation, this need not be around just contraception. It's true of anything, any sexual health related issue.
hmm,
If the comfort setting is not there, the woman is not going to open up, then the advice will not be appropriate. So
100%.
if you're starting to talk to somebody and it sounds to you like that person is not listening, then that's not the place to continue having that conversation. I can't think of any other way of saying it, or
Right.
have the confidence to directly say that this is what I have come for, and
Hmm.
are you going to be able to provide that for me? And based on the answer, you have to take a call whether you're happy to continue or not.
Sure, sure, sure. Thank you so much for this insightful conversation, doctor.
Okay, thank you very
Is,
much.
is there anything else that you would want to add?
The only thing only other message that I would like to leave everyone with is,
Yes.
while yes, it's important that emergency contraception is available and is accessible, needs to be accessible to everybody. I just want us to be cognizant of the fact that there is reliable alternate contraception which should be adopted if there is a recurring need for contraception.
Right.
Like I always like to say that emergency contraception is like a UPS. It will step in when electricity fails. You can't run your systems on UPS all the time, right? So if someone has had the need for accessing emergency contraception on more than one occasion, I think they should pause and, for their own sexual and reproductive health, ask the question, what is the safer form of contraception that I can use so that I can use EC as a genuine backup when uh, something, unexpected happens.
Right, right. Wishing you a happy Women's Day, doctor. Thank you.
Yeah, thank you, and same to you, Shubha.